Community-based care is a benefit to the community and to the individual as it bridges the gap between those who are able to access care and those who are not. It essentially makes care more accessible for those with a mental illness. It enables them to learn about their condition and ways of coping with its effects by providing them with skills that are easily transferable to real-life settings. For a community-based care option to be effective, a multifaceted approach of care needs to be implemented. Simply training general practitioners by providing them with relevant skills and knowledge will not lead to improved health outcomes. It has been found that the most effective way to achieve positive outcomes for those with a mental illness is to ensure that the case management and rehabilitation services are provided within the community and the home, rather than in the case manager's office, as this maximises the chance for recovery. As with any treatment option, community-based treatment is not without its disadvantages. One disadvantage with community-based care is the fact that there is a lack of funding provided to these types of care, as usually the majority of funding goes to primary healthcare services such as hospitals. There has been an outcall for evidence-based practice to be used in a community setting. The problem with this is the fact that there is little to no evidence to suggest that this practice is effective in a community or that it can be implemented in a timely manner to have benefits to an individual. Community-based care has also been found to cost about the same or even more in some cases than institutions, as it places emphasis on there being a specific quality of care for each individual, thus putting pressure on a healthcare system that already doesn't receive a lot of funding in the first place. This form of care also places a huge responsibility back on the family, straining relationships and sometimes increasing homelessness as families are unable to cope. Stigma is also a huge issue with mental illness in general, but when treatment is placed back in the community, the stigma that there is an unstable person within the community was a topic of contention for many.